Assalamualaikum warahmatullahi wabarakatuh. Hello everyone. Let me introduce myself. My name is Maryam Jamilah. You can call me Maryam or Jamilah or anything you want. Okay. And before that, I would like to thank the English course leader, Miss Fourus, who has given me the opportunity to present. And the little of the presentation that I will deliver is level of public knowledge of analgesic drugs in self-medication to treat acute pain. Okay, analgesic drugs or painkillers are one of the drugs that people often use independently without a doctor's prescriptions. This causes several side effects from analgesic drugs. Analgesic drugs have side effects including hypersensitivity reaction, stomach and intestinal disorders, kidney damage, and can cause liver damage if consumed in expensive doses. Self-medication is a community effort to deal with pain that occurs especially acutely or suddenly. Self-medication can be a source of medication errors due to limited public knowledge of drugs and their use. And then, analgesic are drugs used to reduce or eliminate pain or painkillers without losing consequences. These medicines is used to help relieve pain. Whether we realize it or not, we often use it. For example, when we have a headache or toothache, one of the components of the medicine we take usually contains an analgesic or pain reliever. Okay, and then antipyretic drugs are drugs to reduce fever. Just lowering body temperature when hot is not effective in normal people. Can reduce heat because it can inhibit prostaglandins in the CNS. Non-steroidal anti-inflammatory drugs are drugs that reduce pain, fever, and inflammation. That class of analgesic drugs is divided into two, namely opioid narcotic analgesic and non-narcotic analgesic. And first, opioid analgesic are a group of drugs that have properties like opium or morphine. This class of drugs is used to relieve or eliminate pain such as frustration and cancer. Example, methadone, Ventolin, codeine, non-narcotic analgesic drugs in pharmacology are also often known as analgesic, peripheral analgesic. And second, peripheral non-narcotic analgesic, which consists of drugs that are not narcotic and do not act centrally. The use of non-narcotic analgesic drugs or peripheral analgesic drugs tends to be albeit to eliminate or relieve pain without affecting the central nervous system or even reducing the level of consciousness. Okay, the next self-medication is an effort made by the community to overcome complaints or symptoms of disease. If done correctly, self-medication is a high contribution to the government in terms of maintaining national health. Okay, the point of self-medication is an effort made by the community to deal with complaints or symptoms of disease independently without the help of a doctor. Pain is an unpleasant sensation in the body and can be treated by administering anti-pain medication or analgesic. Pain can occur suddenly, so people often self-medicate or self-medicate to overcome it. Painkillers of analgesic are a type of drug that has side effect is used excessively. Therefore, self-medication must be based on sound science. If people have got knowledge about analgesic drugs, then people can use analgesic drugs correctly and rationally. And finally, there is a bibliography from the journal that I log. And maybe that's all the presentation I can convey. I hope it's useful. I'm sorry if there are lots of mistakes. Maybe this is for me. Thank you for attention. See you, goodbye.